Hello guys, and welcome back to my channel. If you're new here, I just want to say a big thank you for tuning in to my channel today. For my usual subscribers, I just want to say thank you for always being here and for always showing up. I really appreciate you guys. So on today's episode, I'm going to discuss a topic that has been, making the rounds on social media, over the past few years because it's become really popular. Now, I'm making this video because a friend of mine had, commented on one of my Instagram posts and had said I should do a topic or, like do an episode and then just say a few things about this topic. So that's why I'm doing that today. So the topic for today is BBL. Yes, BBL. I'm sure you've heard about, BBL much more within the past 5 years. It's become really, really popular. And I think most people just know it as BBL, but they do not know the full meaning of BBL. So BBL stands for Brazilian butt lift. Yes. So it's called Brazilian butt lift because obviously it was more common or more popular in Brazil before it became popular like to the rest of the world as we have it today. So it's basically just a cosmetic procedure where ladies have if they feel like they're not really comfortable with the way their bum looks and they want it to be more like rounder and they want it to be better than it already looks. So it's a cosmetic procedure. I would start from the positives about this procedure. So the positives are that number one, obviously you get your dream body. You know, it boost your self-confidence, it boosts self-esteem, you look better in your clothes. If you're the type that likes to see a lot of curves in your clothes, it's going to look better. It might also make you look more desirable to some you know some people of the opposite sex who are into like who like contoured bumps and all those type of things. So those are the positives. Now, first of all, I mean, if you're thinking of having a Brazilian butt lift, that should be your own personal decision. Just as every surgery, you would need to think about you need to think about the fact that am I sure I want to go on with this surgery? Do the benefits outweigh the risk? You need to ask yourself that. So are you ready to take the risk that comes with the surgery? So every surgery has a risk, okay? And it's the same thing with the Brazilian butt lift. So first I'm going to talk about what the procedure is about. So basically your plastic surgeon will take out fat from different areas of your body, purify that fat, and then put it in your bum, and then obviously put it strategically put it in your bum, so it would like be symmetric, have the nice contour and round and well shaped and all that kind of thing. So that's where the skill of the doctor comes in. Yeah, so that's basically what the procedure is. I think sometimes it might take up to 3 to 6 months for post procedure to heal and all that. But like I said, there are some risks that you know can occur when you have this procedure. So number one is the risk of bleeding while in the procedure, bleeding. Number two is the risk of having an embolism. So what that just means is that because they're actually sucking fat out of other parts of your body and then putting it into your bum, some particles or some of that fat that they're putting in can actually block your blood vessels and then cause what we call pulmonary embolism, which can be very fatal, might can lead to death. And I just want to mention here that I think the BBL is the cosmetic procedure with almost, if not the highest fatality rate. Okay, so you just need to be careful. You need to be sure of the doctor you're going to meet. You need to sit down and make that decision and tell yourself, because when you're going for a surgery, it's 50-50. Either and you'll be explained, the surgeon is going to explain, sorry, to you what the procedure entails and the risk and the benefits. So you would have to give a written consent. So you're given a paper, everything written on there, which you will sign. So it's something that you need to sit down and you need to think and you need to process it to be sure that this is exactly what you want. Now, I've talked about the procedure and I'm on the risk now. Things that could happen. So you could have infection, there could be breakdown of the wound, there could be fat necrosis. So what that just means is that the fat becomes, let's just say the fat just becomes like a hard tissue, and it just looks like it's shrinking. Yeah, that's just the layman way to just mention and to just explain that. So it feels like the fat is shrinking, the fat is dying, and it becomes, it doesn't really have a good look at the end of the day. So you might end up looking botched. Botched means you have a Brazilian butt lift and it just doesn't look right because on one part there's fat necrosis, so it's just looking zigzag instead of the round and symmetric way it's supposed to look. Okay, so that's one of them. Obviously, you're not healing properly. You're, the pain that you're going to go through after surgery but I think for that one, your surgeon will give you pain medications to help you through the initial phase of recovery, just like in every, any kind of surgery. Now the question comes, do I endorse BBLs? I would say it's not for me to endorse BBLs. It's for the individual who wants to have the procedure to actually, think and be sure that this is what they actually want. Because, like I said, with every surgical procedure, whether it's a cesarean session, like something like a cesarean session that is very common, there are some risks that happen. Sometimes there is bleeding, and then the bleeding is so bad that the womb of the woman would need to be taken out in the process. Okay, so maybe that's not what the woman had in mind. But then before the surgeon goes in, they would explain the procedure to you and the things that could go wrong and what they could do as a result of things going wrong. And you have be given a consent form to sign. So that's the same way it goes with the BBL. You might want to have this surgery and you feel that everything is going to go well. But then while the surgery is going on, things start to go, things go from 0 to 100 real quick. So you just need to sort of be sure that that's what you want. And then another thing I would like to say is running to, will I say, cheap or discounted, like, hospitals to have this done. What I Because there's been cases of people who are not really qualified to do those surgeries who end up doing those surgeries and people have lost their lives. So I would say before you go to a hospital or you contact a doctor or to get this procedure, you need to do your background check and be sure that this person is certified to actually carry out this surgery. You have to check the success rates of this person, this surgeon. Out of, if the surgeon has done 50 BBLs, how many have been successful? You need to know all those things before running into getting this done, because like I said, it's the cosmetic procedure with one of the highest fatality rates, if not the highest. That is death rate. Fatality means death rate. So you need to be careful, before making this decision and then going ahead to do this procedure. But like I said, the benefit is that if you come out and you have it done and it looks good, it boosts your self-confidence, you're happy, that you have your dream body. Did I have a BBL? No, I did not have one. Am I ever going to have a BBL? No, I'm not going to ever have a BBL because I don't need one. But like I said, the decision is clearly yours. And so, yeah, so that's it about BBL. If you have any questions about BBL or any other medical questions or anything you were not clear with, you could just leave a comment in the comment section. Or if there's any topic you would want me to talk about, just as my friend did, under my Instagram post, and she dropped this BBL thing and said, look, you need to tell us about this thing because I need to know exactly what this is. You can always drop a comment, leave a comment on my Instagram page at Tima Ododo, or you can go to my TikTok at Tima Talks or my YouTube channel, Dr. T698. And yeah, so I would say you should subscribe to my channel, click like, share this page, and let's grow the community. I'll see you again next time, same place.